Once again, another video of Surgery Squad.
Welcome to Surgery Squad's virtual hair transplant. I'm Dr. Susie, and I'll be assisting you with this surgery today. A hair transplant is an outpatient procedure that involves transplanting hair follicles from one part of the body, known as the donor site, to the balding part of the body, known as the recipient site. Although hair transplantations are typically used to treat male pattern baldness and restore eyebrows, beard, or chest hair, they can also be used to fill in scars caused by accidents or surgery. Today we'll be using the strip harvesting method to treat our patient's male pattern baldness. Strip harvesting involves removing a small strip of scalp from the donor site under local anesthesia and transplanting the pieces or grafts of the scalp into the recipient site of the patient's head. Before the surgery, our patient was advised by his doctor to avoid using any medications that may result in a poor take of the grafts. These medications include, but are not limited to, aspirin, ibuprofen, and antacids. Alcohol use and smoking before and after the surgery can also result in poor graft survival. To prepare our patient for the procedure, we'll need to first shampoo his hair with an antibacterial agent to help prevent any infection. I think you can handle that.
Sure I can. Happy face.
So fresh and clean. Thoroughly rinse the patient's hair and we're ready to get started. The next step is to define our patient's target hairline. Go ahead and outline where we want the patient's hairline to be.
That should do it.
That looks good to me. Let's prepare the donor site. We'll begin by trimming the patient's hair in that area.
I thought he was going to trim off my... I'm trying to gaff tape or something.
Now that the patient's hair is trimmed down, we'll need to mark the area that we'll be removing. Great job! Inject local anesthetic into the marked injection sites to reduce the amount of discomfort our patient may experience. Great! He won't feel a thing. Now we'll need to remove the piece of scalp we outlined from the donor site. Use the scalpel and cut along the line to begin the process. Next, we remove the piece of scalp from the donor site. Make sure you have a good grip.
Hope I have a good grip on my mouse. Let me just roll that back for you. Oh.
Once removed, we'll prepare the piece of scalp for grafting by dissecting the individual follicles. But before we do that, why don't you go ahead and suture the donor site?
Wait, what? Well, I didn't have to do anything? My mouse? Oh. You won't notice a thing.
Great, let's get to some dissecting.
That doesn't sound
The first
good.
thing that we need to do is cut the removed scalp into sections. We'll dissect this one section of skin while our medical assistants take care of the others. Let's remove the individual follicles from the donor material using a pair of tweezers and a sterile razor.
Sounds dangerous. Do I just... Yeah.
Nice job! This step is repeated thousands of times to get each follicle prepared. I'll have my assistants finish up. To prepare the recipient site, you'll need to first inject a local anesthetic into the scalp. We don't want our patient to be uncomfortable.
Sure.
Now we need to make tiny incisions into the recipient site so that we can place the grafts into the scalp. Use the microblade to make the incisions in the recipient site.
What just happened?
Perfect! With all of the incisions, it's getting a little messy there. Let's get that cleaned up.
I think I got a little bit of ketchup on my finger. Little bit of ketchup sauce there. This video's going really long.
Much better.
Okay.
Use your tweezers to pick up and insert the hair grafts into the recipient area.
One by one. Am I actually supposed to do all of them? No, I'm not. That'd be horrible if I had to.
You're a natural. Now that you've got the hang of it, we'll repeat these steps for the remainder of the recipient site. After the procedure has been completed, our patient will be prescribed antibiotics to prevent wound or graft infections. For up to a week after the procedure, the donor area may be sore and some numbness may be experienced as well. Our patient can also expect moderate swelling and redness during this time. Shampooing of the recipient area is typically started 2 days after the surgery. This is important as it prevents scabs from forming. If scabs do form and are left to bond to the hair shaft, the newly transplanted hair follicles may be lost. In about 10 days, our patient will return to have his sutures removed. During the first few days after surgery, almost all of the transplanted hairs will fall out due to shock loss. Shock loss occurs when the hairs are traumatized by their relocation. Within 2 to 3 months, the patient can expect new hair to begin to grow from the treated area and continue to thicken during the following 6 to 9 months. And that's hair transplant surgery. Why not try your surgical skills in another surgery here on SurgerySquad.com?
I will try one. Okay, I will see you later in the next episode of Awesome Surgery Squad. See ya.